In today's video, we're going to look at the benefits of serrapeptase and the correct doses you should be taking. Let's get into it. Serrapeptase, also known as Serratiopeptidase, is a proteolytic enzyme. This is an enzyme that breaks down protein. It was originally discovered in the intestines of silkworms and used by silkworms to break down their cocoon. The serrapeptase found in supplements, however, are made in a lab through fermentation of bacteria. Serrapeptase has many clinical uses, so let's get into the evidence. Many disorders such as sinusitis, osteoarthritis, rheumatoid arthritis, bronchitis, back pain, carpal tunnel syndrome, and inflammatory bowel disease involve inflammation. Most of the current treatments for these conditions include using non-steroidal anti-inflammatories. However, they do come with possible long-term side effects. Serrapeptase is an alternative that can help to reduce inflammation. Traditional NSAIDs block an enzyme called cyclooxygenase, which will shorten to COX, which then prevents the body from producing chemicals that cause inflammation. Serrapeptase also works on the COX enzyme to suppress the release of anti-inflammatory chemicals such as cytokines. A double-blind placebo-controlled trial of just under 200 people with ear, nose and throat disorders was conducted, and they found that there was more improvement in symptoms in those taking serrapeptase as opposed to the placebo. There is potential for serrapeptase to be used in conjunction with other anti-inflammatory medications for enhanced relief of pain and inflammation. Serrapeptase can help in respiratory conditions such as bronchitis, COPD, asthma and pulmonary hypertension. It helps to break down and clear mucus, as well as having the anti-inflammatory effects. In a 4-week study in Japan, serrapeptase was found to reduce sputum output, thickness and also decrease coughing. It's been found to break down and thin the mucus, not only in the throat and chest, but in the sinuses as well. Theoretically, it could help with COVID-19 by reducing the mucus, dissolving blood clot and reducing inflammatory cytokines. This could potentially reduce the risk of a cytokine storm, which is an overreaction of the body's immune system. There is a suggestion that taking the combination of serrapeptase and vitamin D early in the COVID diagnosis can prevent the development of complications and death caused by a cytokine storm. Keep in mind this is all theoretical and we don't have any trials yet in this area. Atherosclerosis is a buildup of plaque inside your artery walls, which can lead to stroke and heart attack. Serrapeptase dissolves blood clots and atherosclerotic plaques by breaking down fibrin and other dead or damaged tissues. Most of the studies have been lab studies, so it's definitely not recommended to start replacing your blood thinners with serrapeptase. A biofilm is a community of microorganisms that sticks to moist surfaces by a slimy layer. The issue with biofilms is that they can be resistant to the immune response and antibiotics, which can lead to chronic infections, particularly involving implants and medical devices such as catheters, pacemakers and prosthetics. Serrapeptase helps to stop the formation of these biofilms, and used in combination with antibiotics, it's been found to have a synergistic effect. In a study of 64 adults with peri-implantitis, success rates at 6 months were 96.9% in the group taking antibiotics with serrapeptase versus 78.1% in the group taking just antibiotics. With antibiotic resistance becoming a worldwide challenge, we might start seeing serrapeptase being prescribed alongside antibiotics. It's still a bit early to tell as studies are very limited. It's really important to note that serrapeptase was a pharmaceutical drug in Japan but was discontinued in 2011 due to lack of clinical evidence. Side effects of serrapeptase may include stomach upset, nausea, loss of appetite, cough, lung inflammation, muscle aches, joint pain, a severe skin reaction called Stevens-Johnson syndrome, and issues with blood clotting. Dosages range from 10mg to 60mg per day. That's equivalent to 20,000 to 120,000 serrapeptidase units per day. It is destroyed by stomach acids, so it is best taken in an enteric coated form. Take it on an empty stomach at least half an hour before food or 2 hours after food. Long-term studies are limited, so you shouldn't take serrapeptase for more than a month at a time. If you are taking any blood thinners, don't take serrapeptase unless advised by the doctor. If you have surgery coming up, particularly in the next 2 weeks, make sure to stop taking serrapeptase so it doesn't affect your bleeding. So that comes to the end of the video. If you found anything useful in this video, please consider subscribing. Thanks for watching, and I hope to see you next time. Bye!